Hello, everyone. For those of you who are just joining us, hello, hello. For those of you who've been hanging out with us for a few minutes, hello again. It's so wonderful to see you all here and to just see names popping up as folks are filtering in. We're going to go ahead and get started just with a few logistics for today. My name is Lily Harvey, and I'm an attorney at Homebase. And I'm joined by many other home basers who are here to help support you all today and getting the most you possibly can out of today's event. So don't hesitate to reach out to us. Next slide, please. Just going to run through some details about Homebase and some logistics. So Homebase is a public policy, nonprofit working across the country to build community capacity to reduce poverty and end houselessness. We launched our criminal legal system initiative in 2019, and we're providing our services to justice system partners and housing and homelessness system partners to try to improve housing access and outcomes for people who've been impacted by the criminal legal system. And we are happy to answer any questions about what we do and where we do it, so feel free to reach out anytime. Next slide, please. I'm going to touch briefly on the convening goals, but I'm also going to just take a couple minutes to run through some logistics. I'm going to start with the logistics piece of it. I'll just leave the convening goals up while I'm moving through this. First, we wanted to make a couple notes on participation. If folks are looking for closed captioning, you can find that in the bar at the bottom of your Zoom screen. Hopefully a lot of you are familiar with that or have hopped on a little bit early so we could walk you through some of that. But there's a chat function down at the very bottom. We're going to use that a lot. Folks are going to be muted upon entry, and for the most part, we're going to stay on that until our breakout activity. But please do feel free to put any questions or comments you have in the chat box, and we'll have home basers monitoring that, and we'll make sure that we'll get those into the rotation as best we can. Also want to point out the live transcript function down at the bottom. It's the CC button for closed captioning. Please feel free to use that if it's helpful. And reach out to us anytime. We do have a scheduled break in the middle of the program. It's about a 10-minute break, but we know a 3-hour Zoom is very long. So do feel free to hop off camera and take care of all of your human needs. We will be here waiting for you when you get back. Also a note on the convening resources, we are recording today. So if that's something that you prefer to either change your name or hop off camera, something like that, feel free to do what you want to do to make yourself comfortable. We will not be recording the breakout activity or the chat box, just so you know. And we'll be circulating the slides and the recording after the event. We're also going to send out an attendee list that's going to have your name that you used when you registered and your email. If you'd like to opt out of being on the attendee list, feel free to let us know. Our hope is, however, that by circulating that, we'll be able to build on some of the community that we are going to create here today. So you can reach out with follow-up questions, to ask for help, to share resources, things like that. And finally, at the end of the presentation, we're going to be doing a feedback form for you all. It's super important and helpful if we can get as many of you to figure that out, because to fill that out, so then we have really good ideas for our future events. And if we get meaningful feedback, a lot of folks responding about that, we're also happy to share that information back with you in case you are planning your next convening that we can come to. I put up the email there too, clsi@homebase.ccc. homebasecc.org. Please feel free to send any thoughts about the convening or reach out anytime if you have questions about Homebase or the Criminal Legal System Initiative. Next slide, please. All right. And before we get started in earnest, I just wanted to take a moment to encourage you all. I know it's not quite as easy when we are on Zoom, but to just take a glance around the virtual room. When we started out to put this convening together, we weren't sure how many people would be able to come together, but we were overwhelmed with how many people were interested in joining us here today and really heartened by that. We have folks from all across the country, New York, Washington State, Oklahoma, all over the place, all throughout California, rural, suburban, urban, incorporated, unincorporated, north, south, in between. We really, again, encourage you to reach out and to get to know each other as best we can, to stick around for the activity at the end where you'll be able to work together to get some action steps for future reference. We also just wanted to acknowledge how many different sectors and spaces people are coming from. We've got folks with all kinds of professional and personal experience in the with the criminal legal system, with housing and homelessness systems, folks from law enforcement, parole, probation, district attorneys, advocates, abolitionists, community members, all kinds of people, health sector, public health, behavioral health, lots and lots of people recognizing that even though we are all working really hard to better meet the needs, the housing needs of folks impacted by the criminal legal system, there's a ton to do, and we all have a responsibility in helping better address those needs. Next slide, please. So here's our agenda for today. We're going to start out in just a moment with our fantastic keynote speaker, Ms. Vonia Quarles, and then we're going to be moving into our panels. Our first panel is focused on innovations, exciting things people are doing in the space. And we're going to have a facilitated Q&A afterwards. So please do use the chat box throughout the presentation, and we will be gathering your questions and getting through as many of them as we can during that facilitated Q&A time. Then we'll take a short break and come back for our second panel about resources, how we can leverage funding opportunities and other resources to make sure these innovative projects are being buoyed and continued and replicated throughout the country. We'll do another brief Q&A after that, and then we're going to go into some breakout groups where we're going to do a facilitated collaborative activity. We call it your goodie bag of sorts. I always liked parties when I was little, birthday parties that had goodie bags. So this is our version of that, where you will be able to leave here today with some very simple but hopefully powerful action steps that you can start later today or tomorrow if you want to wait. So we'll be doing that collaboratively in smaller work groups as our final part of the day. And then with that, next slide. All right, we'll go ahead and leave this up. I think the commitment slide was already up there. So this is the commitments and logistics that I ran over just for reference. It shows you again the chat box and the live transcript box there. So with that, I'm excited, very excited to get the program started with our keynote speaker, Ms. Vonia Quarles, who's joining us from Riverside County. She is a woman of many, many experiences and perspectives, and I'll let her introduce herself a tiny bit more to you. But one of the many things that she's done is she is one of the co-founders of Starting Over Incorporated, again, down in Riverside County, and she brings just a wealth of personal and professional experience to share with us here today. So with that, I'm going to go ahead and turn it over to you, Vonia. Thank you so much for being here, and thank you all for being here.
Thank you, Lily, and thank all of you for being here. My name is Vonia, and I'm a native of California. I've been here all my life, which is a very long time. And I'm a third generation convicted person. So I've been well aware of what we call collateral consequences associated with convictions. And I'll go into that some more, but I'd like to know who you are. We can guess, and I can guess at why you're here. I think Lily did a really good job of saying who is in the room, but I think there are lots of reasons why folks are in this space. And we might come from different practices, different work, different beliefs, but I think one thing that we share is a desire to do something better when it comes to housing. And the number of people that are unsheltered in this time, in this space, I think there's over 565,000 people who were unhoused prior to the pandemic. So we don't know what's happening now in terms of numbers, but we do know that that's a whole lot of people. One of the things that we did prior to the COVID pandemic was to go to a river bottom. And I don't know how many of you have river bottoms in your area, but a river bottom in Riverside is a place where there are communities that exist. There are mayors of these communities, and they're basically people who are living in a space that's not meant for humans to inhabit. And what we have found in doing our surveys, and we surveyed over 250 folks at the river bottom in Riverside. And what we found was that 76% of these people had criminal conviction histories. And so one of the hugest barriers we see or saw was related to criminal conviction histories. The second one was evictions. So convictions and evictions are what we see to be the greatest problems in terms of finding and giving access to people who need housing. So why are we here? I think some of you are probably here to share what's working and what isn't working. You're here to demand change. You want to hear about ways to fund housing for people who've been impacted by incarceration. And you want to meet other people who are also doing exciting and innovative work in this space. That could be why some of you are here. Next slide, please. So Starting Over is a very small nonprofit founded in 2009. Prior to that, we operated loosely. We thought that we could get housing beds and take away the problem. We could provide a bed for somebody and everything would work out. And what we found was we were a Band-Aid, and a very tiny Band-Aid on a problem that was systemic, much more than it is about behaviors. And so our work has been around looking at different housing policies that impact system impacted people. Starting Over has helped over 1,000 people since we've been doing this work. We use a model that was created by A New Way of Life Reentry Clinic, and they do both housing and they also do policy and civic engagement work. So we believe in a strength-based model, and we've been working to address some of the housing policy issues that we face in our region. So I'm here because collectively we have a problem with notions around who deserves housing. And I'm going to say that again. We collectively have a problem with notions about who deserves safety and housing. Housing is so connected to security that one cannot really develop the sense of security while being unhoused. And that's a reality. And I'm not saying this based on science. I'm saying this based on experience. As a child who grew up with directly impacted parents, I knew a long time ago that there were issues that we faced that other people didn't. Housing had always been an issue. Between convictions and evictions, we were homeless as children, so we didn't have this security. And so when we think about it today, we fast forward to 2021, when we have policies like crime-free housing that determine whether a person can get housing or not. And it's based not on how a person is living today, and instead we're basing it on what they've done in the irrevocable past, then we're creating maybe a well-intentioned policy barrier, maybe it's not well-intentioned, but the outcome is the same. We have a problem, we have a challenge with determining who should be safe, who should be secure, then who should have access to housing. Following a felony conviction, the American Bar Association determined that there were over 14,000 collateral consequences, those things that weren't included in the sentence handed down by the judge, that impact the life of people when they come out of incarceration, and not just their life, but the lives of their children and their children's children. And that to me is part of the reason why I'm in this space, whilst, why Starting Over does the work that we do. And we cannot do the work that we do without working with you on the work that you do. So I'm gonna go to a poll. We can go to the next slide and pull up the poll. I just kind of want to get a feel for where you all are. I think I know, but I just kind of want to know some more. So if you could complete this poll.
Wonderful, thank you. We're seeing some responses start to come in. We'll give folks another 30 seconds to weigh in on our poll.
Thank you all for taking the poll. And I look forward to your responses. How many people in America have some sort of criminal record? 2% says 17 million. 19% say 24 million. 34% says 39 million. And 46% said 74 million. And the answer to that poll is actually 74 million, according to FBI classifications and other records, says that 74 million people have some form of criminal record. How many children in the US are part of families in which one or more adults have a criminal record? Less than 10 million, 10 million, 20 million. And I can't see the next poll question from here, so let's see if I have it. It is 34 million or 60 million. And we have 3% with less than 10 million, 7% with 10 million, 22% with 20 million. I can't see the rest, but I can tell you that it's between 33 and 36.5 million children have at least one parent with a criminal record. And that's nearly half of the children in this country have a system impacted parent, directly impacted parent. The next question, how many housing units are there in the United States as of 2019? The answers are 139, 139 million, 200 million, 260 million, 480 million. And the data shows there are 139 million housing units in the US. Now this question is interesting. How many cities and states in the United States have crime-free housing programs? One response is, I have no idea. The other one is 100 cities to 25 states. Another one is 2,000 cities and 48 states. Another response is 4,000 cities, 50 states. So really, I don't have any idea, because in doing the research, the only stat that says anything is offered by the National Crime-Free Association. Their response is that there are 2,000 cities, 48 states that has crime-free housing programs. However, their response isn't based on any data that they were actually able to provide. So I don't know if they're saying more because they're marketing crime-free housing. I don't know. So I don't have any idea, but that's what they say, 2,000 cities, 48 states. So my next question, or the next poll question, is, do you think crime-free housing policies increase public safety? And that's the question. That's the question that we need to answer. Crime-free housing policies were enacted supposedly to increase public safety. In application, we find it to be very, very different. So while the intention may have been good, the results have not. The outcomes have not. So the reason why I say this is because I work with people every day who are facing housing crisis, who don't have access to housing because of criminal conviction histories, and because family members have criminal conviction histories. So whole families are punished unintentionally, I'm going to say unintentionally, because of a policy that was supposed to generate public safety. But how can one be safe when over 565,000 people are unhoused? How can one be safe if they cannot provide the basic necessity of housing for themselves and their families? And that's what we're talking about today. How do we change that? How do we examine something that we thought was helpful in the light of day and be open about the outcomes and where we need to go? And so we can go to the next slide. So these are some of the things that I see in my work. And it's basically, like I said, the two greatest barriers to housing for people are convictions and evictions. And I think another one that's coming up a lot is a failure to qualify, to income qualify for low income housing. In our area, what is happening is people who are on fixed incomes like Social Security are being disqualified from housing assistance because they don't make enough. And many of these people are system impacted people who have spent decades inside a carceral system and worked in that carceral system, come out and have nowhere to go. Come out and cannot be an asset to their family. They come out feeling like they're a burden. And so convictions and evictions are the two most important. And I really think in our work and your work, that if we're really going to talk about public safety, we need to look at what public safety should be. And public safety should be safety for all of us. And we should not be living today in 2021 with policies that determine who isn't worthy of something as basic as housing access. So public safety demands housing. We cannot talk about public safety without addressing housing needs. And this whole idea that public safety belongs to someone else or some other entity. Oftentimes we think that public safety is in the court of law enforcement, but actually public safety is in our court. It's in our yard, it's in our remit. What are we going to do to improve public safety? And while we might work in community, this public safety cannot be delegated outside of ourselves. We are the public, and public safety is our responsibility. And looking at failed systems or failed policies, policies that are not giving us the intended results are failed policies. And if we're seeing failed policies, it becomes our responsibility to address those. I think that's my personal opinion. And in looking at the housing policies that are in place, we are saying who we value and who we don't. We live in a world, in a state, in a country that recognizes that the United States justice system is not colorblind, is not blind at all to race or class. So when we start shaping housing policies based on a criminal justice system, we are skewing the outcomes for housing for far too many people based on race and based on class. And so the housing policies are saying who we want here and who we don't, who we value and who we don't. So what are we going to say today? What are we going to say today? What are you going to say today? And when we think about housing and we think about corrections or correction system, which is really a penal system, when we think about those systems, we have to remember that we're not talking just about a person. You know, we have decided to punish a person after a conviction. The family is connected to that person. And so to punish that person beyond the life of the sentence punishes the family even beyond the life of the sentence. And perhaps into the next generation. And so when we talk about policies, we talk about generational poverty, these go hand in hand. And I think today you wouldn't be here if you didn't want to say that we all are worthy of housing, regardless of our status. Today, I'm a practicing attorney. Today, I run a business. I carried the collateral consequences of my conviction into my personal life, into my family. I ran from this for a very long time because of the stigma. And it is that stigma that allows policies that harm people to continue to exist. So we have to lift the stigma of being system impacted, directly system impacted, formerly incarcerated. We have to lift that stigma and look at things as basic as housing and housing access. And I want to thank you all for listening and thank you for being here. I'd like to share some resources and references with you. So if we could go to the next slide. There is a safe housing network that started here in California. It's a national network, and it helps people who are re-entering obtain safe housing throughout the country now. And actually, it's an international program. And you'll see that link second to the bottom. The Department of Fair Employment and Housing has come out about crime-free housing and how it's used. In our region here, we have gotten a couple of cities to remove their crime-free housing ordinances, and we are continuing to do that work. We appreciate your work and your compassion to want to be at a conference that's focusing on addressing this gap in our humanity. And then all the other resources and references are information and data that supports the need for removing crime-free housing from local, state, and federal policies. I'm looking forward to an exciting conference and being part of it. And I want to thank you for allowing me to speak with you this morning. Thank you and enjoy the conference.
Thank you so much, Vonya. I think we all really appreciate your time and your wisdom and that framing. I think you touched on a lot of topics that will be coming up today about who needs to be doing what, and the answer being all of us, and also really outline of the rippling and really long-term effects that housing instability and houselessness in criminal legal system involve carries, not just for the individual, which is certainly a lot there, but continues to carry generationally, and how that doesn't just go away, though it would sure be great if it did. So thank you again for your words. I'm going to go ahead and turn it over. I know folks are still drifting in, so I just want to put a quick plug in. If you're just joining us now and you have any questions or want to get oriented or have tech issues, please feel free to reach out to me, Lily Harvey, through the direct chat, or Nicole Thomas, also through the direct chat. We will be your tech check-in folks for the day. And with that, I'll go ahead and turn it over to my colleague, Byla, who's going to get us started with our first panel. Byla?
Hi, everyone. Good morning, and thank you, Vonya, again for those words. So I am also one of the members of the team here at Home Base that is running the convening here today. And I'm going to be moderating today's innovations panel. And during this panel, we are going to hear from three wonderful, innovative panelists, all working at the intersection of the criminal legal system and housing. Today's panelists are Aisha Tu Yusuf, who is the Director of Innovation Programs at Impact Justice. They are stepping in for Tara Lawyer, who unfortunately couldn't join us today. Victoria Kirschner is also joining us. She is the lead mentor for the San Jose State University Record Clearance Project. And we're also joined by Kathy Myers, who is the Reentry Program Coordinator in the San Diego County Sheriff's Department. So without further ado, I will go ahead and hand it over to Aisha Tu for their presentation.
I assume my slides are going to show up. Yes. Okay, great. So hi, everyone. I'm Aisha Tu. I'm the Director of Innovation Programs at Impact Justice. As stated, I'm filling in for Tara Lawyer, who unfortunately couldn't make it due to a family tragedy. For all of those who know Tara, because I see some really cool smart partners on this call, we all know Tara is the force behind the Homecoming Project and the person that really keeps us all going. So I'm hoping to do a decent second best. So I'm Aisha Tu. Again, I'm from Impact Justice. Impact Justice, simply put, is a research and innovation organization that really works at kind of three sectors of the justice system. One is diversion, one is conditions, so what's going on in prison, and one of the biggest ones is also reentry, which is where the Homecoming Project comes into play. I oversee a multitude of the programs at Impact Justice, one of which is the Homecoming Project, which is probably one of our biggest national projects that we have regarding reentry. So do you want next slide? So, I think Vanya did such an amazing job of kind of framing what a lot of the issues are around housing when it comes to people that were formerly incarcerated. So I'm going to not go in so much detail, but I think that was so sufficiently covered. So thank you for all of that and your amazing work. But, the problem that the Homecoming Project was trying to fix was that there's poor access to housing for people leaving prison, particularly those that have been in prison for a longer period of time. There was a lack of individualized care. So not necessarily like overseer care, but care in terms of people that are leaving prison that need a little bit more closer hand holding or a little more closer navigation of the community once they exit prison. And then the second piece is increased risk of homelessness. So we particularly, the Homecoming Project, which I'll explain just a little bit more detail, the Homecoming Project really is about our people that have been in prison for longer than 10 years, served or sentenced for longer than 10 years. What we know is that that population has a lower recidivism risk, so a lower risk of going back into the system, but a higher homelessness risk. And that's partially because they have a higher risk for joblessness, higher risk of having the hardest time re-navigating back into their community. So for the Homecoming Project, we really wanted to target our efforts to the folks that have a lower risk of going back to the prison, but have a higher risk of not having a home. And when you don't have a home, that also makes you a higher risk of mental health issues, of not being able to get jobs and reconnecting with your family and all of those things. And the third thing the Homecoming Project is really hoping to provide is the lack of support of reentry services for people leaving prison that again have been there for a longer period of time. I think overall there's a lack of reentry programs across this nation for everybody that's living in a carceral system, but particularly for those who have been there a longer period of time, which usually makes them older adults coming back into our communities. There's a lack of supportive reentry programs for them. And so the Homecoming Project was really hoping to really dig into these issues of the problem and the why and how we created the Homecoming Project. So next slide. So the Homecoming Project, the easiest way that we like to talk about that homecoming is Airbnb for people leaving prison. So we all as a society are now really used to this like sharing economy model, where whether it's Uber or Lyft or any kind of sharing economy, we are now used to this sharing economy model. So the purpose of the Homecoming Project was to take that idea of a sharing economy model and use it for a different population that is too often unseen and uncared for. So what Impact Justice does is we recruit host homes, which are individuals that have a room in their house in the communities in which we serve, and want to rent out that room, just like any other Airbnb, just like any other roommate that's happening in the nation. And a big thanks to our funders, the Homecoming Project is able to pay a stipend to that homeowner to rent out their room to a person that's leaving prison. So we pay for 6 months of housing for the people that are leaving prison to come into that host home. We also provide a community navigator, or a case manager is another way to put that title. And that is, again, because the lack of individualized care, people often end up homeless or recidivate and all these things because they don't have someone to really help them navigate this new community that they're now in after being gone for such a long time. So we provide them with a community navigator. And how that often works is that the community navigator is a little more hands-on at the beginning, but over time really has individualized care. So they know when it's time they can back off on different areas and where to kind of step in on different areas as well. And they have that community navigator for that entire 6 months that they are placed into that housing. And the community and navigator has ongoing support for them. And also the impact justice team overall has ongoing support and really are really attentive to their needs. The goal really was around this. People that are leaving prison, oftentimes why they choose our model of this is they don't want someone that's overseeing what they're doing. They just spent a large amount of time in prison where someone was overseeing what they were doing. So they really wanted to have a home, have support, but also be able to operate as individual and autonomous adults. And we want to give that to them. So but the other thing we do too is provide a cell phone and a Chromebook, right? How are you going to find a house? How are you going to find a job? How are you going to find mental health services? How are you going to find your family? All of these things if you don't have access to a cell phone and a Chromebook. So we provide those things for the people leaving prison as well. And then care packages, thanks to some of our other funders that we have, we provide each person that comes out and enters one of our homes a care package that has gift cards for groceries and food and even clothing items, and also necessary hygiene materials. And then because the climate that we're living in, we also had to make some changes regarding COVID-19 and PPE and provide supplies and testing. There's a whole protocol that we have regarding COVID. Happy to talk about that later to keep everybody safe. We've actually had no incidents, which is really great. But we do provide all of those supplies for both the homeowner as well as the person that's coming into that home, and provide access to ample testing as much as needed to make sure everybody feels safe. Next slide. So who do we bring into our program? So we actually use, what most people are thinking about when I talk about homecoming is how do you decide who goes into what house? How do we create safety and all of these things, right? But one of the things we also I like to talk about on this project is, we go to the grocery store every day, we hop into Ubers and Lyfts and airplanes and hotels, and we have no idea what anybody's background is. But the minute that we say, oh yeah, this person was in prison, is often when people start having high alert, right? Which is, when we don't know, people don't care, but when we do know, it's a different conversation. So one of the things that we're consistently doing is really working on narrative change for people leaving prison or folks that have criminal records. So the way that we do a match between the host home and the person leaving prison is we use the CDCR assessment tool. And that assessment tool, I'm not going to go super deep into that, but that tool is really used internally inside of the prisons to really assess that person's risk level, the work that they did while they were in prison, the work that they do in their own reentry and their own rehabilitation and their own education. So we use that assessment tool to assess folks when they're coming out to know kind of like their risk of placement and recidivism and all of those things. So we actually didn't create our own tool because someone else already had one, and we're really believers that there's something that's working. Let's use that. So we use that tool as one of our markers for matching. And then we also we're in 2 counties right now for now, Contra Costa County and Alameda County. So we also only look at people that are paroling to both of those counties and where we have host homes. And then our last kind of piece is that folks that are qualified for this program also cannot be listed have committed a crime that makes them eligible for the sex registry or any other sex offense. Next slide. So homecoming is growing. We have a desire, and will do, because it's by Set Out Amazing grant that we have, we will place 120 people into host homes over the next year and a half. Well, we actually have 2 years to do it, about halfway through that period of time. So in the next year and a half, we'll place about 100 more people into host homes in Contra Costa County and Alameda County. And we are well on our way to doing that. One of the big things that we're doing is doing a media campaign and some marketing campaigns around recruiting more host homes to do that. Our program really grew from just an idea about 3.5 years ago to a program that's now been on NPR, the New York Times, all of these things, because it's really a model that any community can do. Because a few things that we're really aware of are people are leaving prison all across this nation, globally actually, and that there are empty rooms all across this nation. And there are people who want to fill those rooms for either financial resources, they want other people in the house, or they want to do a service to their community. And so our goal is to, over the next year, so starting early next year, we'll be creating a toolkit so that different communities have the opportunity to build a homecoming project within their community and serve their people leaving prison in this type of model. What I think is really what I think about in terms of equity. What equity really is about choice. And one of the reasons the Homecoming Project exists is because there should be more choices in the type of housing that people leaving prison have the opportunity to get. Up until now, there's most of the programs are either mandated, they're congregate, they have lots of rules in their home, all of these things that maybe somebody doesn't need. Maybe they don't need that level of care. And so there should be a choice in where the other housing opportunities that people leaving prison are. Just like other people who don't have records or who have their records further back have also a choice, these people also deserve choice. So we're building a toolkit to hopefully be able to do that. And that'll come out next year. And we're also scaling at this moment in time. So recently we scaled into Contra Costa County, and we hope to scale again to some of the bigger counties within California over the next year. We do all of this by community partners. We don't exist without community partners. It's the people and the organizations that are doing much of this work that allow us to exist and that we get to work in partnership with. So when we were creating the Homecoming Project, the first thing we did was to go out and talk to folks that are doing housing projects, that are doing reentry projects, that are doing services project for the population in which we serve. And we continue to garner new partners, but also work to cultivate the ones that we have to ensure we can continue to provide a whole cadre of services for people that are leaving prison in this manner. We are also growing internally as a staff. I think because of the growth of the Homecoming Project, we actually hired 4 new staff members over the last 4 months to help serve the need of this project. Next slide, which I think is my last slide. Oh, okay, that was my last slide actually. Yep. So that's kind of the nutshell of the Homecoming Project. I know I only have about 10 minutes to talk about this phenomenal program. But I think what's really important is that, and like what I would like to leave you all with before I get to questions, if you have them for me, and I'll also answer your questions in the chat once I finish talking and turn it over to the next person, is really thinking about how we use our economy to support the people leaving prison, right? We already have, like, what we're doing is what we like to think about as like a cyclical effect of what's happening, right? So we have funding from our grant supporters that we are putting money back into the hands of community members that have open homes, which is back into the economics of that community, and supporting somebody leaving prison who desperately needs that housing so that they too can come back and be a contributing part of this community. I think when programs really succeed is when we really start to look at how everyone can be a contributor to everybody else's success. And I think that is what the Homecoming Project is really aiming to do. So I'll stop there, and I don't know how we'll do questions. I can answer the couple that are here, but yeah, so I'll stop there.
Thank you so much. I completely failed to mention before we got started that we are going to be taking questions in the chat, and what we're going to do is collect them all, and then at the end of all the presentations, we're going to do the Q&A at that point in time. But also, if you feel like there's a question that you can easily answer in the chat, go ahead and feel free. But I just want to encourage people to, if you have questions, just go ahead, pop them in the chat so everyone sees them, and then our panelists will answer them at the end. All right, so I am going to go ahead and hand it off now to Victoria.
Hello, everybody. My name is Victoria Kirshner, and I am the lead mentor with San Jose State University. We call ourselves P2E, which is Path to Expungement, but I'm employed through the San Jose State University Record Clearance Project. How our program came to be is San Jose State Record Clearance Project was expunging people's record. And Margaret Stevenson was talking to people to find out, what the needs were that people needed re-entering and getting their records expunged, and what it looked like when they first started the journey and what their path was like. And what she was able to find out is that if there was some way to create a mentoring program to help people, working with people that have walked the common ground, that this would probably be a really good project. And that's how we started, by a little idea, and we've grown and grown. First it was Health Trust, and then it was Health Trust was for both men and women, and then it was Grow, that was for women only, and now we're P2E, and we're have a much larger funding scale. Next slide, please. So in this picture, this is myself and a student assistant and an inmate that I worked with that was, actually, let me give her a different title. We don't like to call people inmates. Client. So this is a client that I worked with, and she is getting ready to get released the very next day. And so we're going over her post-release plan. Peer mentors assist clients in navigating and accessing available resources in the adult reentry network and larger community, and by extension, facilitate record expungement and reentry into the community and the alignment of self-sufficiency. After our clients are on the journey and stabilized, we also encourage them to start working with our legal service team, which is the Record Clearance Project, because at the beginning of your journey is when you want to start the process of expungement, because a lot of our clients, their expungement is discretionary. So I'm not going to go into legal terms, but there's two different kinds of expungement. There's mandatory and discretionary. I'm a former client of the Record Clearance Project. All my stuff was discretionary because I never completed probation without being rearrested. So the best time to start this process is when you're first starting the journey, so you can make all those wonderful connections, so that when your petition is being written, you have really good resources for letters explaining why it is in the best interest of justice to allow the person to have their record granted and expunged. So I think that's it for this slide. If you guys could put me through to the next slide, please. So this is the great team that I work with. Well, actually, these are the mentors that I work with. There's a large amount of people behind the scene of the mentors. So that's myself, Diana, and Darlene. And the mentoring program, like I said in the previous slide, we are mentors who have gone through the expungement program ourselves. So all three of us have gone through San Jose State University Record Clearance Project. How people connect with the mentors. Normally we get our clients about 45 days from being released from custody. We do presentations in custody, and also the rehabilitation officers that are in Elmwood facility are very familiar with us. If they have a client that they feel would be good for our services, they connect them to us via an email. After we get the email, we figure out which mentor will be working with them, and my boss reaches out and gives the rehabilitation officer the phone number of the correct mentor for them to call, collect. We like to work with people prior to getting out so that we can establish a relationship with them and build trust. Trust is a really big issue. You know, a lot of former clients tell me, you know, people promised them the world, and when they got out, those were unfulfilled promises, and there was absolutely no one there. So we like to be with our clients every step of the way so that they know that there is somebody truly on their side that understands what they're going through and willing to advocate for them. We do this through post-release plans while they're in custody, and stabilization plans once they get out. Mentors also work with people who have been released 30 days and longer. So basically, if you've already been released, what the one criteria is you have to be eligible for reentry services through the Santa Clara County Reentry Center. And as long as you can get what's known as an RTS referral, where the Reentry Center enters the person's information and phone number, sends it to my boss and one other person from our agency, and they look at it and figure out who should be the person doing the pre-screen. Every client is pre-screened first to make sure they're eligible for services. And the number one things that we're looking for is people that are homeless upon release, unemployed, and need the guidance for self-sufficiency, excuse me. Our mentors help clients obtain virtually any resource they need in becoming self-sufficient. We've helped people with many things. I heard the agency that presented before me talking about the care packages. It's very similar. If we have clients that have lost everything, the mentor meets them at the store. We take them shopping, for their basic needs. We have hygiene kits, we have gift cards. We help them with the CalFresh application, with the SSI or SSDI application. We help them with getting their IDs, their social security card, anything that they possibly can need. I have clients that, a vehicle is very important. They save for the vehicle, they get the insurance, and then there's some repair that's needed, to be able to get the registration for the vehicle. We've helped with minor repairs. The list could go on forever of the things that we're able to assist with after we get approval for it. Next slide, please. Our main focus is on housing. Like it's been mentioned time and time again in this presentation, if you don't have a safe place to go when you are released, it makes it really hard to move forward into self-sufficiency. They have a nickname for me. I'm sometimes called the Houser, because I really realize how important this issue is, because before entering this project of getting my record expunged, from age of 18 to 40, I was in and out of the system. I couldn't even tell you. I've been arrested more than 100 times. I've been to prison. I've been any county I went to, and I did many geographical changes. I ended up incarcerated in their county. And what would happen is I would be incarcerated and I would plan to do things differently. And I got out and I had no place to go. And so I resorted on the things that came easiest for me. So housing is the biggest thing. And what housing looks like for us is we have a wonderful organization that's called the Blackbird House Respite. It's where if we have a client struggling with staying sober or struggling with self-care, they can go there for 2 weeks of intensive, great care. This place is absolutely amazing. Only 6 people there, 2 people in a room. The food is great. The only complaint I have from my clients that I place there is they don't want to leave. After that, we place them in sober living environments, which are SLEs or THUs. We also refer to emergency shelters, residential treatment programs if that is necessary, and then we assist once we've signed them up with permanent housing solutions. There's many things we use. The greatest tool that we got now is the Section 8 interest list, which is reopened, and it's not so much for the Section 8 interest list, it's to get to the voucher list where they're actually pulling presently. And there's so many housing opportunities on that voucher list. And there's really good opportunities for people 55 and 62 and over. We also use stabilization assessment plans to guide and support our clients as they achieve their goals and move up in the system. They're responsible to meet with their mentor on a minimum of once a week. Normally during the pandemic, this is done over the phone. Or like I said, we meet them in stores if they need shopping. And most of my clients, when I first start working with them, we probably talk 2 to 3 times a week. And as they go through the system, it lessens. Next slide, please. So our program challenges and strengths. So, the challenges that we face with clients all the time is trauma from being incarcerated. And, the biggest trauma is trust, and is I find it's allowing them space to learn how to feel the feelings that they're feeling and not run from them. A lot of times people, get a feeling, it doesn't necessarily have to be a bad feeling. It can be a good feeling and they don't know how to process that. And, they start, wanting to resort to things that they were comfortable with. Helping clients build self-esteem, finding housing programs for people of all genders. That's an issue. And then last but not least on the challenges is finding housing for people on the 290 registrant. That can be really difficult. And I truly believe, as being a person that's turned my life around, everybody deserves housing and everybody deserves the right, after they've done their time, to be given the opportunity for rehabilitation. Strengths of our program is mentors build a unique trust with clients because we're not clinicians, and we can share with them when they're going through trauma or they're going through a difficult time. We can share with them how we can relate to it and how something very similar happened to us. And it always makes me get teary-eyed when I think of it. When I start sharing with clients stuff in my journey, they really see it through a different perspective. They know that there's somebody on the other side for them that's not that a clinician would ever be judgmental or, or think anything different, but it's just very easy for them to communicate. I've learned in my job that when I listen totally neutral. I mean, my clients are really good. If they're saying something to me and one eyebrow even goes up just a little bit, or I close one eye, they sense that instantly. And I just want them to know that we are a safe person navigating for them. We also have RCP graduates who later on become, that's the wrong thing. RCP graduates, so people that graduate our program after being referred to the expungement department, if they want to come back and be a peer mentor like me, we strongly encourage it. It really gives the clients that I work with, they instantly, want to start, they say a lot of times, I want to do what you do. And so, that's what we do. We take them by the hand, we show them how we got to where we got. And when we close them with services, they're connected to the Record Clearance Project. They start working on that. And, I recently have a client that I worked from the very beginning with. I met her at the reentry center. I'm banging her head in the wall, didn't know what to do, was sleeping outside, a really hard time in her life. We signed her up. I worked with her for about a year and a half after she got closed. I became her sponsor. I still work with her closely. I watched her get all the rewards, employment, housing. And a couple of days ago, she went to court. She got her record expunged. So she's made the full turn. And now she wants to come back and do what I do. And I get goosebumps every time I think about it. I'm so excited that I got to be a part of that. Our relationship with San Jose State University students, we could not do our job without the students. The students help us every step of the way. They are so willing, and they get, they cheer the mentors on. They're always so quick to tell us how our stories, make them want to continue in the Justice Department even more. But they're so compassionate. They're so vibrant, and they just bring so much to our team. It's a great thing that I'm employed through San Jose State University and that I get the help of these amazing individuals that are young, or they're all different ages. Some of the students are, older, but they all bring so much to the plate in helping our pieces move together and ultimately help our clients achieve self-sufficiency. And last but not least, the team members that I'm employed with, we're such a great team. We support each other in every single way. I get suggestions for, it's really hard. Sometimes we take on the stress of our clients. We can have like 3 clients that are chronically having stuff go crazy. And, someone will call me, one of my coworkers, and I'll be like, ah! And, they remind me that self-care is so important. And, I love that I work with this organization and group of people that are totally there to support me and our clients in this beautiful opportunity of self-sufficiency. I would not be the person I am today. I would not be where I am today without the San Jose State University Record Clearance Project and the support of everybody from my agency and the amazing students. When I first walked in there, I was so scared, and these students helped me. They were non-judgmental. They guided me every step of the way and met me where I needed to be met, wrote this beautiful petition for me to allow me to get my record expunged. And I cannot say more about this wonderful agency that I work for. Thank you very much. My name is Victoria.
Thank you, Victoria. So we are going to go ahead and turn it over now to Kathy.
Good morning. My name is Kathy Myers. I'm a reentry program coordinator for the San Diego Sheriff's Department. I've been with the department about 8 years, and I supervise our Stepping Up initiative and pretrial services, which seems like a totally tangential project, but it goes together more often than you would think. So just a little bit about our department, just so you can think about the scale, during a non-COVID year, we have approximately 80,000 bookings, and about 60,000 of those are unique individuals. Our coordinated program releases that I'm going to be talking about in a minute here account for about 3,000 of those releases every year. We have a very big county geographically, and we have 7 detention facilities across the San Diego County region. I'm going to give you a swift overview of 2 projects that I've been asked to present on. So it's going to be kind of an overview, and then you've got my contact information up here. If you decide that you want to try out one of these projects, you can get in touch with me and we can look at more specifics that you might need to know. So I've been asked to talk about one of the projects that has made Stepping Up successful, which is a good release, and we'll talk about that in a minute. And the other is to talk about our SIT project. So SIT is Supporting Individual Transitions, began in October of 2018. The target population is 100 individuals who had the highest number of bookings per year when we started the project. Next slide. So this is some data. What you can see on the top is data from the year October to September. We have a weird start date, 2017 to 2018. The number below in the white section is the numbers after the end of our first year. So the first one is looking at total bookings. So just as a point of reference, we had about 1,200 bookings a year from these 100 individuals. So you're talking about people who are basically averaging about 28 bookings a year, which means as a medium number, they are in custody for about 3 days most times. You know, you're in on a drunk in public or something like that. So the median number is 3 days, and then out in the community for 10, and then they're back. So it is a very unique population in that they're not in the jail long enough to really get connected to services. They're also not in the community long enough to get any services. So we decided to really focus on just these 100 individuals to see what would we need to do to make this turnaround. So the project, I have 5 discharge planners that work on this project. They meet with the individual every single time they come in. Every single time they're booked, we have a running tab that alerts everybody in the morning of who is in custody that day and at what facility, so that we make sure that we have those contacts. During the first year, we had 811 contacts. And really what we're trying to do is build on the relationship, right? Because that's really, nobody turns around because of the program on paper. They turn around because of people like Victoria. They turn around because of the relationships that they have with the counselors who give them the support that they need to want to make a different plan. We really decided to focus on a long-term look, since that was the one exception. No one is looking at these folks long-term, right? They're in 3 days, they're out for 10. So it's very short. What we decided to do was, let's just pretend that they're going to be here all year, because the reality is if they come back every 10 years, they're sort of here all year, right? So we decided to look at them long-term. And what the difference that made is there are a lot of services, at least in our county, that are attached to how long you have in custody before you leave. So for example, we do Affordable Care Act enrollment, Medi-Cal enrollment. Well, we do that for people when they're in their last 30 days of custody. With these folks, they're typically not even going to court, so they're not sentenced, so they don't have a 30 days to the gate kind of time frame. So what we've done is gone to the county and said, hey, could we change the way that we submit this paperwork so that it's not 30 days before they get out, it's just going to be sometime during this year, and got agreement on that. I think both for the county and for the department, we weren't aware of how many people were really in this population. It was a lot of folks. We just took the top 100 and moved, but they're, 2 years later, we started another 100. So it's a significant group of people, and obviously a significant cost. Booking is very expensive. So if you're looking at it from a county perspective on just the financials, you're spending a lot of money to provide no service to the same individuals repeatedly. So it's hard to pitch a case for that. I know we're going to spend a lot of money, but we aren't going to do anything for them, right? So that was the other part of it, was to really look at it from this long-term perspective and assume that, okay, if we apply for your Medi-Cal, you may not be able to use it when you get out this time, but the next time you will. When next time you come in, we'll give you information about that Medi-Cal, about your enrollment, so that we can move forward the next time that you're out. We have worked, again, basically on that premise of relationship. And what we ended up finding was we had 55% of the people agreed to services. And sadly enough, we found that many of them, the response when we said, hey, would you be interested in this time when you leave going to a program? What was sad was how many of them said nobody had ever asked them. Nobody had ever asked them if they wanted to go to a program. Nobody ever asked them, why are you back every 10 days? Again, because they were here so briefly and in the community so briefly that they were just simply invisible, except when it comes to the financial cost, right? So we really focused on high contact, high touch. It's not an inexpensive program because you are talking about very high touch contacts programming, but the cost to do nothing was pretty expensive as well. So that was what we were kind of balancing against. At the end of the first year, we were able to get 48 of those individuals off that top 100 list. I think the other thing to understand about our Stepping Up is that our goal for all our Stepping Up programs is that each individual would have the opportunity to spend more time in the community than they did the previous year. Instead of saying you were here, 28 times this year, next year you won't be here at all. Like, what's the likelihood of that? It's not good. So if we can just pick a goal that works for us, but more importantly, that works for the client, that's what they want out of next year, right? They want to spend less time in custody and more time in the community. So that's really how we've worded our goal, which I think is helpful in terms of talking with clients about it. I think they have a better understanding of what that means when you say, we want you to spend more time in the community. The programs that we have referred to some of them are Housing First programs. We have a contract, the county has a contract with PATH, and they have a program where they work Housing First, but also work on all the other pieces that need to happen to try to turn this person's year into our goal year of more time in the community. We have a program through Neighborhood House called Project InReach. That's an intensive pre-post release case management program. And they are really focusing, both of those programs are really focusing on what it is that the client feels is keeping them from moving forward towards that goal again. What it is that, where's the point that they're doing well until they fall off, right? Again, the sheriff's departments in the past have always been focused on people while they're in custody. And when they leave, they typically belong to the probation department, to the community or whatever. And we've really found that by focusing, especially for those folks whose criminal justice incidences intersect their behavioral health, that you can't do one or the other, right? What we do know if we do nothing is they're coming back. For the most part, the individuals who have these high behavioral health needs will return if we do nothing. You can go to the next slide. So, okay, we'll go with this one. The second program I wanted to talk with you about is our coordinated program release. And this was because when I talked with Lily, she said, hey, I've talked with other counties and they're having struggles with the same thing. This is a project that we started when individuals in the community would go to community meetings and they would say, you keep saying that you're discharging people with 10 days worth of their medication, but they don't have it. And, we're looking at our books and we see, yes, that person got theirs. So what we did was just reverse engineer, talk to them about who got out that didn't have any meds. So once we knew that, we could trace backwards. And what we found out was that our computer system was set up to say, this is the people who are leaving tomorrow who need their medication. Well, what we hadn't thought about was the group of people who get time served, right? The day before, we don't know they're leaving. So we've done nothing about their medication. And sadly, in San Diego, embarrassingly, we do not have a computerized court system. Our court still relies on paper. So at the end of the day, we're actually waiting for stacks of actual paper to come through, and we're flipping through them, looking for the people who get time served so we can get them right out as quickly as possible. So because they're not computerized, the medical services division has no idea they're leaving. And that's where we figured out you end up having a lot of your very vulnerable populations are the folks who are getting time served. They've got minimal crimes, misdemeanors, or whatever. Once they've been sentenced, they've been here long enough, and especially during the pandemic, because it's a very slow process, they're out the door. Same day they're gone. So then we started backing up and really planning for releases, especially those that target programs. So we have a program called a coordinated program release. We involved the medical services division, the reentry division, inmate processing, the providers, and the clients. So it is a very collaborative project that kind of calls in all the pieces. So with medical services division, we are asking them to, instead of doing handwritten prescriptions and putting them on people's property, which is very slow, we said, how could we do this different? What would we have to do to get this to be something that you could do by 4 p.m. the night before they leave? And so we've worked with them back and forth and finally refined a fax system where by 4 o'clock the day before the release, we send them all of the names of all of the releases, and we have the providers select which CVS pharmacy is convenient for them so that they can then fax it to that place. So that way the provider is getting it near them or near the treatment program or wherever that individual is going. With inmate processing, it was the same discussion. How late in the day can we go and still get these people released at a time the following day? They have to do their finals records checks, and typically they were doing them overnight. The problem with overnight is those providers are already there the next day to pick those people up. And there's been no warning that, oh, this person ended up having a warrant and so they can't leave, or whatever the millions of things that come up during that last minute. So they were able to rework part of what they do so that at 2 p.m. they're doing their look from 2 to their 2 o'clock shift, so that when we get them all turned in at 4 o'clock, they can have them all run by 5. And that way the provider can check their email and go, oh, somebody had a warrant, so we're not going to go pick them up. Something else has happened. But it also gives us the capacity to do time served cases where we can say, okay, this agency wants to pick up this person tomorrow. And then we just put a big yellow highlighted section that says this release is pending today's court action. And that way they're looking for the paperwork with that one individual's name when they're doing their first flip through. So that instead of like, okay, that will be done, with sending all of our time served cases out by 8 o'clock tonight or whatever, well, then the program's gone home, right? So they're looking for those same day live to try to get them out by between 3 and 5 so that we can get them out to the agencies before they close up shop. Some of our agencies, Project InReach is one of them, are staffing over the weekend because people get out of jail on the weekend. So they actually have, Tuesday through Saturday shifts and Sunday through Thursday, so that any day that the court order says is their release date, they can go on those days. And we work with those providers and said, what would you need? When do you know it? How quickly can you get it? And then we talked to clients and said, walk me through your typical release. What's the bad part? What's the better part? How could we smooth some of this out? Next slide. So this is a portion, I don't know if it's as fuzzy for you as it is for me, but this is a portion of our coordinated release. So you can see that what the agency who's picking the person up fills out. So the person's name, their booking number, their birth date. the date that they want to pick up, and typically there's the time. And then there's the pharmacy that they're interested in using and where they're going to be taking this individual. We do that because we have some programs who are, let's say, a probation department pickup, and they're actually taking them to an agency. So we need to know where they're going to go so that we make sure we've got everything ready. And then a contact number for the agency, so we can call them and go, hey, by the way, this guy's warrant didn't check out, and so he's not going to be able to go. And then what facility they're going to pick them up. So, and we have an admin person who's fancy high tech, and that where it says submit on an actual release, when they click on that button, it automatically opens an email that's automatically addressed to everybody from those departments that needs to see this release. That makes it easier. If you're going to try this, it makes it easier because staff change, they go to different programs, and then you're sending out, oh, now you have to use these emails, and now you have to, and you'll have people like parole agents or whatever who will only do one a year. So when you miss them by changing stuff, it creates chaos. So this button works really well. We have a distribution lift. We can change it whenever we want to, but the provider doesn't need to know that there's been a change made. Again, the deadline is 4 p.m. and then we do a pickup the very next day. Next slide. So what we've learned, one is that in the custody setting, some people's job is about people. Some people's job is about moving, correcting, observing, paperwork, databases, numbers. And this doesn't work well if you can't humanize the process a little bit. So, for example, if I have to call inmate processing and say, hey, is there any way we can do X, Y, Z? You know, they can say no, right? So we've got to really focus on what it is that we want and how to kind of humanize that. So I'll call and say, hey, you know what? We really need to make sure this goes through. This is an elderly woman. She is mentally ill. We cannot just let her out onto the street without doing something. And then people go, oh, right. Not that they weren't, you know, good human beings before, but we're paying them to move pieces of paper and to be correct all the time, which is incredibly stressful as well. I think it's been nice for them to have the opportunity to deal with people as people, but you do have to give them that opportunity. When we went to each department, like medical services or inmate processing, going to them and saying, what is the problem? Here's what our problem is. How would you solve it? Because we were trying to figure out how are we going to get those written prescriptions faster to the right location. And we kept fiddling with it and fiddling with it. And then I just happened to be housed next door to the head pharmacist. And I said, like, hey, so here's my problem. And once he heard the problem, he goes, no, that's not going to work. It's never going to work. And I'm sitting there being heartbroken. And then it says, wait, we got to go. Okay. It's going to be just quick facts and go. So the other things, start small, get a distribution mail list so that you're all on it, get a cell phone because stuff happens after 4 p.m. That's just the way it is. And in terms of funding, look at the money that you have and look about how you're spending it and see how you could prioritize a portion of it to this. It's not free, but it's worth it. Thank you.
Thank you very much, Kathy. Thanks to all of our panelists. So we're just going to we have a couple of questions that people put in the chat, and then we're going to move to a quick break. But the first question is for Aisha too. It says, so if people are interested in connecting to the Homecoming Project, how can they reach out?
Yeah, the simplest way is you can actually just reach out to me and I'll connect. I can either answer the question or connect you to Tara. So my email, just for everyone to know, is ayusuf@impactjustice.org. So that's an easier way. You can also, there's also a contact on our website that I'll throw into the chat at Impact Justice that has like a connect for more information about it. So I'll put both those things in there. I'll put that in there in the chat right now.
Thank you. And then we have a question for Kathy as well. Kathy, your program sounds amazing, says the person in the chat box. Do you think it would work if a county did not have as many resources?
I'm not sure that I know which program. I think we're talking about the SIT program. I think it wasn't as resource expensive as we might have thought. What you have to do is you have to get the providers who work on the outside, what we refer to as on the outs. You've got to get those providers to help you match up those pieces. So I think it would work. But you've got to have someone on the other side.
And we have a question for you, all of you, whoever is interested in answering any of the panelists. So what advice would you give to someone or to an organization interested in getting a project like yours started?
Give us a call.
So
I think for
Kathy
me,
directly.
yeah. I think give us I think I'm with Kathy on that one. Give us a call / send an email. But the other thing I would say is the success of the Homecoming Project has really been based in the community. So, for us, like I said, we're building a toolkit and we're going to be happy to share and provide all kinds of technical assistance for folks. But I think really one of the couple of things that's important is understand the need of your community and what the people that are leaving prison really need. And the way you do that is by one, speaking to them. And then second piece is speaking to the folks that are doing other work in regarding people either in or currently released from prison. So doing that, and then just start to do your outreach around like, what is your project you want to do? Who are you, what's your population you're trying to target? Right, every program doesn't target every population. So what's the population? And then who are the organizations that are doing the work to target that population in different ways? And then you can start to build community momentum from that. I think the biggest thing that I would guard against is like doing a program on your own because you want to do it and not understanding like the data and the people that are doing all of this work, because it's a recipe for disaster. It's also a recipe for not doing things with the community in mind. And so that's what I would say.
Can I add one thing, please?
Yeah.
This is Victoria from San Jose State. I want to say that I'm really fortunate to be in Santa Clara County. What's a really great thing here is we have a one-stop shop. I didn't really get a chance to mention that, and that's the Santa Clara County Reentry Center. So clients can go that are recently released or that have been justice involved within the past year. They even make some exceptions if it's past that 1 year mark, and they can go and they can find out about all these agencies that have services to help them. I feel really fortunate to live in the county that I live in because there's, I feel a lot of options here for people. When I first started my reentry, I wish there would have been the reentry center, but I feel blessed to be a part of that organization now. It's a really great thing if your county has a reentry center for people to go to and reach out to that are reentering from incarceration. It's a real win-win-win.
Thank you very much. I'm going to hand it off to Nicole now. Thank you all for your questions, and to all of our panelists. It was wonderful to hear from you.
Yes, thank you once again. So now we're actually going to take a 10-minute break, and we'll promptly start back up at 11:03. But we really urge you to stick around. We've heard about some incredible innovations, and we know that all innovations need money, partnerships, and resources to support them. So that's what we're going to learn about when we come back, and then we'll have a collaborative workshop activity to close us out.
Hi, everyone. Welcome back, or welcome back on camera if you can and are able to. Just a quick plug for that. I know it's painful to live in Zoom land for so many reasons, but to the extent people are able, please do come on camera so we can get to know each other in the only way we have, which is through screen. And so the presenters feel less lonesome in the world. If you can't, totally fine too, but just wanted to put in a plug. We're going to go ahead and get started again. Thank you everyone for sticking around with us. We're going to be moving on next to our resources panel. And again, just a plug, if you're joining, I know some folks had to sort of switch devices. If you're needing to sync up your audio and your video, just go ahead and reach out to Nicole and she can help merge those two things together. And with that, I will turn it over to Nicole, I think, or maybe Monica.
Yes, thank you,
There we
Lily.
go. Monica.
Wonderful. So thanks, everyone. Welcome back from break. And thank you again to our awesome innovations panel speakers. I'm very happy to turn it over now to our resources panel. As we talked about during the break, wonderful innovations do need to be backed up by resources. And we are very happy to have joining us today 3 excellent resourceful speakers to tell you about what they've been doing in their communities. First, we're going to be hearing from Josie Halpern Finnerty to talk to us about the Safety and Justice Challenge from the San Francisco District Attorney's Office. Then we will be hearing from Jacqueline C. Ramirez, the Director of Housing and Employment, to talk to us about Life Moves Reentry Program. And finally, we'll be hearing from Ryan Eisel, Director of Housing from LA County DHS from the Office of Diversion and Reentry. So I will go ahead and turn it over to Josie to get us started, and the slides will be up momentarily. Thank you.
Well, good morning, everybody. I'm very happy to be here with you all today. Again, my name is Josie, and I am the project director for the San Francisco Safety and Justice Challenge. I am based in the San Francisco District Attorney's Office, so I am very much speaking to you from the perspective of the criminal justice system today rather than the housing system. And I have the honor today of sharing with you all a little bit about some of the work we've done to build bridges to housing for people leaving jail in San Francisco. Next slide, please. So first, a little bit of context about the Safety and Justice Challenge. The SJC is a national effort funded by the MacArthur Foundation to safely and sustainably reduce the jail population and racial disparities in jail. In San Francisco, the SJC is a partnership among our key criminal justice stakeholders, public health, and community organizations. We were formed in part around the need to close a seismically unfit jail, a goal San Francisco accomplished in fall 2020. The SJC partners organizations played a critical role in San Francisco's COVID response, building on the foundation of collaborative work that all of the organizations had done together to help prevent an outbreak in the jail. Next slide, please. So with a county jail foreclosed and as the pandemic continues, our work together is more important than ever. And we are seeking to address the persistent racial disparities in our local jail, which remain unacceptably high, where Black people represent nearly half of the jail population. So our SJC partnership has organized our work around the 5 strategies you see on your screen here, believing that each of these are necessary to accomplish those shared goals that I just mentioned. Today, I'm going to be focusing, of course, on some of the work we've explored under our Healthy Connection strategy related to housing. Next slide, please. So as many people have spoken to already this morning, why are we talking about housing? Why are a bunch of criminal justice people, particularly someone who sits in the district attorney's office, trying to talk about housing? A lot of folks have hit on some of these themes already, but for our partnership in San Francisco, we know that many, many people in jail are unhoused or unstably housed. Over 30% of our local jail population identifies as unhoused. We believe that housing is essential to public health and that public health is essential to public safety. And we're not satisfied with jail being our societal response to people in need of shelter or care. We know that system involvement can push you into homelessness, and conversely, that housing support can prevent further system involvement, as so many folks have spoken to eloquently today. So yes, folks in the criminal justice system must talk about housing. Next slide, please. But boy, is it outside our comfort zone. Oh, look, you have my cute animation. Please, next. In San Francisco, as elsewhere, the problems around housing are so massive, it can feel hopeless and overwhelming to engage at all. As one partner said to me, you used to be able to get someone on SSI and they'd be able to find a place and make it work. Not easily, but it was possible. What are you supposed to do when that is so far outside the realm of possibility? And the system is so complex. We try to navigate your systems, housing folks here with us today, and they are so complicated, which I know is very rich coming from someone who's part of the criminal justice system. But we don't understand why someone who is homeless and in jail doesn't necessarily count as homeless when it comes to accessing resources. And as community partners have said to us, imagine how it feels for people who actually have to be in both systems and try to navigate them if it feels confusing to the people who are part of those systems. And it's often as if we speak totally different languages. So I can talk to you about MTRs and PSA scores all day, but when you tell me that someone is housing referral status, I don't know what you mean at first. I remember an early conversation with a partner on the housing side of things who asked if a client, a particular person, had been assessed. And we said, of course, this person has been assessed many times. But of course, they meant capital A, assessed through coordinated entry. And our answer was, we have no idea. So we don't speak the same language. All right, next slide, please. So I'm aware that I'm here on a resources panel. So what are we going to do about these issues? In San Francisco, first, we decided we needed some outside perspective and some co-learning. Next slide, please. So this is one of the things that time-limited grant funds are good for, is perspective and co-learning. So we used these SJC funds to take a trip to LA to see how the model out of their Office of Diversion and Reentry works. I think you get to hear from the amazing Ryan, who hosted us momentarily. But we brought partners from all different parts of our system: adult probation, sheriff's office, pretrial, and Tipping Point, a local grant maker who's deeply involved in our local homelessness efforts. So we spent several days looking at housing sites and talking to people from the courtroom to the community, at least one of whom I know is here on the convening with us today. And over food and in lifts all over LA, we talked about what a similar model could look like in San Francisco. Next slide, please. So we knew that if we wanted to try something new in San Francisco, we needed to bring something to the table, something besides our indignation and righteousness that it was so hard to get people housed. But we didn't have the funds at this time for serious new housing options that could meet the need in San Francisco. So we decided to try to build out a pilot, a model around the resources that exist related to homelessness in San Francisco, because there is a city infrastructure. So we partnered with some of those same folks I just mentioned, with Tipping Point, the Sheriff's Office, and SF Pretrial, the nonprofit community-based pretrial services agency in San Francisco, as well as Episcopal Community Services, adult probation, many others, to try to pilot ways of helping people better transition from jail to community. So through this particular transition project, over the past year, the partnership has worked to improve connection and advocacy with the coordinated entry process for people experiencing homelessness, to ensure timely access to housing and resources, such as problem-solving funds, rapid rehousing, or permanent supportive housing. I'm trying to learn the housing lingo. The pilot provides case management for people who are transitioning out of jail through a grassroots community-based approach that's in partnership with government agencies. It includes housing navigation for people who are on the housing referral waitlist to ensure they can quickly and successfully enter permanent housing. And it provides flexible funding for interim housing where existing resources are not available or appropriate. So helping us to figure out what's missing and to meet real needs right now. We're also fortunate that we have an innovative adult probation department in San Francisco who've been working really tirelessly to develop new housing options for people involved in the justice system. And their leadership has really been critical in expanding emergency reentry housing options as the pandemic continues, and helping people transition into housing out of custody. Next slide, please. Oh, one back. Thank you. So as we've embarked on this journey, we have tried to build in some supports along the way. We've built relationships with people who can help us connect and talk across systems such as Tipping Point and Homebase, so shameless plug for our hosts here. We've provided technical assistance for our criminal justice partners on how to speak housing and to navigate the housing landscape. We actually did a whole training for some of our partners and for some of the folks in the DA's office on what does housing first actually mean. And we've tried to bring different groups into conversation, leveraging not just our safety and justice challenge space, but the local reentry council convened by probation, as well as trying to partner. We're just starting to try to partner with a major local housing committee. So trying to use all of the different spaces where people gather to bring us into conversation with each other. And in those spaces, we've sought to involve and hear directly from people who have lived experience in both systems about what's missing, what's working, what's not working, which is many things, and how to make improvements. And we're also developing research partnerships to help us learn more about racial disparities in the housing and criminal justice systems and about people who have frequent contact with both systems. And if any of you here today have found that it is easy to share data across housing, public health, and criminal justice systems, please send me an email and tell me your secrets, because it's been, a long challenge for us to get that far to be able to do some of that work. So please, next slide. So what have we learned so far? This is very much evolving and a work in progress, and I don't pretend to have any solutions here today. Even with some fast and flexible money, we have struggled to house people leaving jail. But I would say from my perspective, we have learned a few things thus far in our journey. And I would say one of those is that the criminal justice system needs to get more comfortable with the idea that sometimes housing is enough. And that disruption in housing due to incarceration has serious consequences. And we need to seriously build out our portfolio of housing supports that specifically meet the needs of people leaving custody and are responsive to their identities and their life circumstances. Too often, folks in the criminal justice system are the first to be pushed out of housing supports, and we really need to design and build around their needs. The work is hard. Clients will have setbacks, partners will offend one another inadvertently or disagree about how to use scarce resources, and partnerships really are everything. A foundation of trust is essential to help us keep building together. And next slide, please. So where are we building to next? I would say it's all very well to help people transition out of jail, but as one of our partners said, there must be something at the end of the rainbow. So we have more work to do to build pathways to long-term housing and support when they're needed. We also have more work to do to make sure that we know when people who are eligible for existing city supports, long-term housing supports, come into custody. Many folks are going to be back in community in not too long a time, and we need to know when they come into custody and plan accordingly. We need to do more to build confidence among criminal justice partners that housing options will provide strong support for people exiting jail. And we definitely need to embed more peer professionals who understand the justice system within programs. And we need to figure out the funding. Grants are great for pilots and for testing out new models, but in my opinion, they're not great for long-term serious infrastructure. So we need to figure out how we're going to blend together different ongoing funding sources to sustain models that really focus on people who are coming into contact with the justice system in San Francisco. So we will try and try again, just as our neighbors who have to navigate these complicated systems have to do. We will encounter setbacks and we will try to learn from them. And my next and last slide is just, again, I don't have any magic solutions for resources or magic funding sources. But I am personally so grateful to my partners in San Francisco for their commitment to this work, and to those of my partners who are here today, and to all of you, thank you for being bold and being visionary. I am very honored to be in this work with you all. And that is the end of my presentation.
Thank you so much, Josie. And now we will turn it over to Jacqueline.
Good Good morning, everybody. My name is Daca Ramirez. I am the Director of Housing and Employment at Life Moves, and I'm going to be talking to you today about our reentry program. So we're going to take a hard left back to Housing Town from Josie's presentation, and I'm going to start off telling you a little bit about what Life Moves is. We are a homeless services provider in Silicon Valley, so just south of Josie. And next slide, please. Our vision is a community where all of our neighbors have a home. And to achieve that, our mission is to provide interim housing, supportive services for homeless families and individuals in Silicon Valley to rapidly return to stable housing and achieve long-term self-sufficiency. And so this reentry program is under the auspice of the supportive services portion of our mission. Next slide. So how does a traditional homeless shelter provider decide to target reentry services? So for us, I'll start off by saying that in addition to being a mission-driven and client-centered organization, Life Moves has a really strong data culture. And so for the last 2 years or so, we've been focusing on figuring out how to improve exits to stable housing for our single adult population in particular. And I'll just note really quickly that because of that focus on efficacy and making sure that what we're doing actually works for the people that we're serving in the community, we're pretty proud of the fact that over the last year with COVID, we have not seen a decrease in any of our housing outcomes. We've been able to maintain those numbers and in some cases start seeing slight increases. But back to reentry services. So in around January of 2019, the California Board of State and Community Corrections, or the BSCC, which is the funder for this program, issued an RFP, or request for proposal, for rental assistance and warm handoff reentry services. In around the same time, Life Moves and Palo Alto University began analyzing our data to attempt to identify specific factors that might predict stable exits for single adults and families from our shelters. And we found a couple of really interesting points specific to those impacted by the criminal justice system. So the first thing is that from a first shelter stay, single clients reporting having been on probation or parole on their assessment, that capital A assessment that Josie mentioned, had 24% lower odds of exiting to stable housing as compared to those without having impact from the criminal justice system. From a second shelter stay, clients who reported prior incarceration had 50% lower odds of exiting to stable housing from our shelters from that second stay. So just kind of proof of everything that everyone is saying, that criminal justice and where it intersects with housing is so crucial, right? So in March, we decided with this data, and along with some other things that I'm going to tell you about on the next slide, to submit a proposal for both the rental assistance and warm handoff reentry services. And I note that because we conceptualized it as one program working kind of in conjunction with one another. That'll be important later. In July of 2019, we were notified that we were awarded just the warm handoff services portion of the award. And that allowed us to hire one full-time person focused on reentry services. It was $500,000 over the course of 3 years. And that contract was to begin August 1st of 2019. And I note that date because you'll see we found out in July 17th of 2019, and they wanted us to launch a program about 2 weeks later. And then in September of that year, they brought me on, and this program lives under our housing and employment support services. And so one of the first things I was tasked with was launching a program that was supposed to start a month before. That's how it goes with government funding sometimes, as you might know. So fast forward a year, and in last August, we found out that some more funding became available to the BSCC for these programs, and that we were able to get the award for the rental assistance portion of the funding. And we found that out in August. And again, they wanted us to launch less than a month later on September 1st. So next slide. So in addition to the data, we also have just a really strong system in place to identify funding sources. So one of those things is that we're signed up for the California Grants Portal, and anybody could go on there and kind of look for very specific sources of funding. They have a newsletter that you can sign up for, and you'll be notified of different opportunities. What Life Moves does is we are signed up for a ton of listservs, and we all kind of keep an eye out for opportunities. And this one came specifically from an email from the Santa Clara County Offices of Reentry Services. So shout out to them. And they gave us a heads up about this opportunity. And we have an amazing development team. And so their job, in addition to also subscribing to some of these listservs, they keep an eye out, they screen some of the opportunities, they stay aware of the agency's priorities. So they knew about this focus that we were placing on providing some specified resources for our reentry population. And they also participate in things like senior leadership reviews so that they can stay abreast of what's going on at our sites and our facilities, so that they can keep that in mind when they see opportunities. And then we have this thing called the weekly kickoff, and the development team brings those opportunities to leadership, and we discuss as a group and decide whether or not to pursue a particular type of funding. And that's exactly what happened with this opportunity. And so it was just kind of perfect timing for us that we were doing this work to see how to improve services, identifying the need for our reentry population, and then this opportunity from the BSCC came about. Next slide. So we've learned a lot of lessons through this source of funding and through the launch of this program. One is working with a new government agency. We are so grateful for this funding, but it is not without its trials and tribulations. Anybody that's worked with government funding knows that every agency likes things its own particular way. And the BSCC is no different. So we've spent quite a little time kind of on the administration of the grant as a result of that. So that's been a lesson learned. Another lesson learned is having a plan B. We submitted a proposal that went hand in hand with the warm handoff services, so kind of connecting to resources, and the rental assistance, which is the financial piece of things. And we were initially only awarded the warm handoff portion. We weren't anticipating that. We didn't have a plan for it, and we had to pivot and scramble really fast to be able to provide that service. And we did it, but we should have had a plan B. And then ramp up period. So we also should have built a bigger period for hiring and launching the program. It's also a limited funding source. So the limitation on this particular funding source is for those formerly incarcerated in a California state prison. So that leaves us with a gap of resources for those that have only cycled through the local county jails. And we have had instances where folks apply for this program through our shelter and they don't qualify because the BSCC is very, very particular about making sure that this staff only works with this particular group of people. So that's been a challenge. The last thing is similar to the ramp up period, just the projected spend down. We were pretty aggressive in our budget, and we should have built in more of a cushion to account for that hiring time, that ramp up time of launching the services. So yeah, those are some of the lessons learned. Next slide. So the project itself is this. So Life Moves clients come to us through any one of our shelters or outreach programs, and our model is intensive case management. So we are not the imagined shelter that's kind of 3 hots and a cot model where you stand in line and wait for a bed for a night. Folks stay with us anywhere from 1 night if that's what they choose, but hopefully we're hoping to get people to stay and engage in programming for several months. And then we provide a number of supportive services. So one of those is housing and employment, wellness and education, Connect services, which is our post-exit program. And then we also make a number of external referrals. So this program lives in our housing and employment services, and the reentry program provides the following services. So we provide the service to any Life Moves client. They just have to have been formerly incarcerated in a California state prison. It's the one criteria that we have. The referrals come to us from the case managers at the shelter sites. And then we provide targeted housing navigation services, because it seems easy, as Josie said, to find housing, and it is really not. And then you add all kinds of other factors, like having been impacted by the criminal justice system, and things just get that much more complicated. We also have employment specialists, case management services, and last but not least, client assistance. So we're able to provide the financial support needed for those folks who won't otherwise qualify for other kinds of housing assistance because of their background. We can provide it through this program. Next slide. And so the program workflow is that a case manager at a shelter site identifies a client, a potential client, or sometimes they refer for our mainstream housing and employment services. And then through intake, we realize that person has been formerly incarcerated, and so that they qualify for this program, and we'll reroute them. Then we do some intake and screening. The intake coordinator mainly just focuses on confirming that there was former incarceration in a California state prison. We have had a number of people say that they were in prison, not realizing that prison and jail are different things. And so we have to confirm that. We confirm receipt of all requested documentation. And then together with our program lead, we determine which of the reentry services a client should go to. And they could be receiving multiple services simultaneously, but we just want to make sure we point them in the right direction. So these are all those services. I won't go into detail with them, but again, employment, housing navigation, and client assistance. Next slide. So just a little bit more information about the reentry program. We now have about 5.5 full-time employees just dedicated to providing reentry services, plus some supervision. 5 of those staff have lived experience directly related to the criminal justice system. 3 of those staff are bilingual. All of our staff are trained in the Housing First approach, not just for our reentry program, but for all of our housing supportive services. Some of the challenges with hiring has been finding folks with relevant experience to connect with the reentry population. Also folks that have comfort working with certain segments of the reentry population, in particular registered 290s or sex offenders, because we serve everyone in the reentry population. And then the last 2 challenges are kind of related. A fast ramp up time was a really big challenge, would have been so under normal circumstances, but then you threw COVID in there, and that just made things that much harder. So that was definitely a challenge for us. And then these are some of our program metrics so far. So far we've been able to house 16 people, employ 5, 2 have job offers on deck. And then with our warm handoff population that started in late 2019, we've served 70 individuals. And then for our client assistance program, which just started in early 2020, we've served 40 individuals. And there's just some data points about the type of housing people are going into and the types of client assistance that we've most provided for individuals. So thank you so much, and I'm happy to take questions at the end.
Thank you so much, Jacqueline. We really appreciate it. And final panelist for us today is Ryan.
Everyone, good morning or good afternoon, depending on where you're at. My name is Ryan Eisel. I'm the Director of Housing with the Office of Diversion and Reentry. Just a little bit about me in our office. I've been with the Office of Diversion and Reentry for about 2 years, but prior to that, I spent about 15 years doing community mental health and housing, working with local COCs and homeless services, everything from shelter to permanent supportive housing and everything in between. So when Josie says there's a different language, I can certainly attest to that. I'm still getting up to speed with some of the justice language. Next slide, please. So this is a little bit about the work that the Office of Diversion and Reentry does. We're situated under the Department of Health Services in the County of Los Angeles. We do jail-based diversion, so primarily focused on people with serious mental illness and complicated health, physical health needs, harm reduction and community-based diversion, reentry services, and then we have a youth development and diversion program. Primarily, I'm going to focus today on our jail-based diversion and reentry services because that's where the majority of our housing overlays. Next slide. I may have got a little overzealous, but I'm going to try to highlight 3 different things in the next 10 minutes or so that are sort of related, but not really, just kind of some unique tidbits that I thought might be helpful to share with you all. So on day, I think 1, actually starting the job about 2 years ago, I asked my boss, I'm settling in, what are the things that want me to focus on? And she says, we need to bring on 90 new shelter beds in the next 30 days. And I thought, like, are you crazy? Working in the homeless services world, trying to get a new shelter bed up and going. We're talking about a 6-month to a year process, a lot of city council meetings, a lot of, zoning issues, conditional use permits and things like that. And so I was, came home and I told my wife, I'm like, I have no idea how I'm going to do this, but I started calling people. And then the next day I got into work and she says, this is how we do it. We've got a model in place. So I certainly can't take credit for this, but this is something that I thought I would share with you because it's been helpful for us. So rather than doing all that I just described, finding a industrial building in an area that everybody's going to sort of be okay with it because it's far enough from a school and not going to be an area where neighbors are going to come and complain. We really try to do everything by right. So we find small home-like settings in residential communities, and we lease those properties. And we do this really kind of under the radar. So we don't go around saying, hey, we're ODR, we're starting a new site. We do everything really kind of on a small scale. Our providers go in, they find these sites. Sometimes we help connect them to them. A lot of times they're in areas that are zoned for multifamily housing, but there's just a single family home there or a duplex. And so the occupancy standards in the city of Los Angeles and in other areas allow us to have multiple people from various different households to move into a site. And so we're not doing licensed care. We are doing everything that is permitted by the zoning in that area. And because the sites are leased, we're not having to go and develop a bunch of capital to get in there and get these sites going. And so just as a quick example, when COVID hit, we brought on 200 new shelter beds within a 2-week period because of this model. I mean, we kind of developed it. We've got a pretty good system in place, and we're able to, through this process of signing a lease, of providing a little bit of startup funding, of not having to go through the traditional permitting process and things like that, we can get a site up and going very, very quickly. The other thing that this model works really well for is that we have the ability to pivot. And so you guys know, funding comes and goes and shifts, needs change. And so because we're not putting out a lot of capital, because we're not signing, because we're not purchasing these properties, we're able to shift. And so, this leads a little bit of uncertainty to our providers sometimes, but we do everything we can to make sure that if we are shifting, we're continuing to provide a resource for our providers so that they're shifting from one program to another, that they still have revenue coming through. But it allows us to go after funding that is, a year or 2 at a time and kind of, cobble everything together and not have to make long-term commitments on projects. And then the last thing is that we have dedicated PSH, or permanent supportive housing resources, attached to these clients and these housing sites. And so we're able to make sure that there's a flow moving forward and folks aren't coming into the shelter sites and just sitting kind of waiting and hoping. As soon as somebody arrives in the site, they've got a resource attached to them and we can make sure that they're moving forward. And that allows us to kind of right size the resources. The last thing I forgot to mention is that The funding model is that we pay for the beds whether or not they're occupied or not. And what that allows our providers to do is have consistency with staffing, consistency with resource, and to make sure that we have a bed available for somebody when they're coming out of custody. For our diversion program in particular, if that bed is not there, the judge won't sign the release order. And so we need to make sure that we have, basically control over those resources. And it works on both ends. We have control over it. The provider has a dedicated funding resource. Next slide, please. You guys can read this, but we have different housing sites based on the type of resource. So for our high need clients, we have really robust services, including clinical services. And for our reentry sites, we have slightly reduced services just based on the acuity of clients. And so it's really not only can we get these sites up and going fairly quickly, usually they range on the scale of about 20 to 30 beds, but we can tailor them to the needs of the clients. Next slide. So coming from the homeless services sector and having worked in that arena for quite a while, I was used to a housing model where through the coordinated entry system, there's a whole bunch of people that were trying to access limited housing resources. And if somebody was moving from one housing program to another, oftentimes there wasn't very good continuity of care. So an example might be that an outreach worker would engage with somebody, and then they would move into an interim housing site or shelter site. And that outreach worker would roll off, and they would have a new case manager at this shelter site. And then hopefully they moved into permanent housing, and they would have a new case manager at that permanent housing site. And if they fell out of any of those, so they maybe got kicked out of shelter, or they were kicked out of their permanent housing resource, or they just had some issues that came up where they weren't able to stay there, they had to sort of start all over again. And maybe the system was able to cobble folks together cobble together resources through relationships and the fact that this person was known, but the funding wasn't really set up in a way to wrap around the client. The funding was attached to the housing, it was attached to the program, and not the client. Next slide, please. So in ODR, what we try to do as best as we can is cobble together a bunch of different funding resources to wrap the funding around the client. The slides are a little bit small there, but we basically have the permanent housing resource, case management, the temporary housing, mental health services. I can't even read it myself. Our justice partners and our county ODR team are all kind of wrapped around the client, but that's not actually how the funding looks. It's not that the funding is going specifically towards that client. We do this as much as we can all on the back end. So we have several different funding sources that we really just kind of cobble together. And we do some really creative accounting and allocation of funding on the back end so that in reality, it looks like, from the outward perspective or for the clients, that the funding is attached to them. So they can move semi-seamlessly from interim housing into permanent supportive housing. If that doesn't work out, they can step back into back into interim housing. We have clients that maybe in permanent housing, they end up hospitalized, and we have them come back into interim housing for a little bit of a respite to sort of restabilize. And so by drawing on these various funding sources, those of you from California may be familiar with some of these. AB 109 is essentially realignment. SB 678 is mostly through the probation department. It's a focus on using evidence-based practices to reduce recidivism and to increase public safety. The Mental Health Services Act, HUD, and Continuum of Care or Public Housing Authority dollars. And then we have some local, what we call Med County costs, but basically LA local dollars. And so we've funneled this all through this thing called the Flexible Housing Subsidy Pool. I could spend like an hour going over this, but basically we have a nonprofit that administers these dollars for us, and that allows us as the county to work really quickly. And they essentially act like the housing authority for us. And so rather than having a housing voucher that's very discreet, we have basically we go help somebody find housing, and then once they move in, we figure out what housing resource they're eligible for. So we're not saying you have a Section 8 voucher, go find a house. We're saying go find a house, we'll figure out how to pay for it later. And we recognize that this requires pretty robust resources on the back end, because if somebody goes and finds a resource that, or excuse me, a housing opportunity, and we don't have the resource to pay for it, then that doesn't work. And so we have to be really strategic in the way that we do that. We spend down the most restrictive dollars first, and then we progressively move to spending down those dollars that are more flexible. And we hope that at the end of this, we have, enough flexible dollars to cover everything. So this requires that, we have an ample infrastructure to do that, that we make a commitment to every client. And it's a closed system. And, so that's something that's challenging for some entities to do is, so we make a commitment to every person that comes into the program. We make sure there's a resource for them. And in doing that, we're able to keep an eye on the resources that we have available and only make commitments to those clients that we have the resource to fund. Next slide. And then lastly, I wanted to talk about a partnership that we have with Los Angeles County Department of Probation. So as I mentioned before, SB 678 funds probation to use evidence-based practices to reduce recidivism and increase or decrease, a local jail costs, essentially corrective costs. And so an evidence-based practice is housing, is housing first, is rapid rehousing. And so actually similar to the effort that Jacqueline is doing, we have a rapid rehousing program that actually, I'll come to that in a second. But basically, we've got the probation department through some nudging by the board of supervisors and others in the county to invest in housing as one of the evidence-based practice models to reduce recidivism. So this program partners rapid rehousing, so case management and short-term rental assistance with employment support. Probation funds the program. They have the funds, they're the gatekeeper, so they tell us who is coming into the program, and then we essentially manage it for them. So probation isn't the expert on housing, but they want to keep their folks out of custody. And so basically probation is essentially subcontracting with our office, and then we are subcontracting with a community-based provider, a nonprofit, to run those services. It started off as a pilot, but having seen the value of it, we are now able to leverage some local dollars. In my last 10 seconds or so, the latest iteration of this is actually that nonprofit went out and went after the BSCC grant that Jacqueline described. We were funded for the rental assistance part of it, but not the service dollars. So probation is paying for the services portion of it, and then we're leveraging those dollars to the service dollars and the BSCC dollars to multiply the impact. And so probation is basically getting more bang for their buck because we're able to bring these resources from BSCC. All right, I think I'm out of time. Thanks, everyone.
Wonderful. Thank you so much. Thank you to all of our panelists. We have been curating questions for you through the chat. And so thanks to everyone who has been submitting questions so far, and please feel free to keep them coming. So to look at our list here, our first question is for Josie. And our question is, how would you pitch your program to more conservative DAs around the country?
Yeah, I mean, I think the pitch is really making that case that housing is part of stability for folks, and just kind of pointing out what is true in many, many places, if not most places, which is that a lot of folks are going to cycle in and out. And most DAs, I think, would like folks to be achieving more stability. And so anything that's good for public safety is good for DAs. That's the short version. I know it's a longer conversation than that, but that's my short answer.
We appreciate it. We also got a number of questions related to serving clients. And so to open it up to our whole panel, do you have strategies for helping those who are recidivating, that are chronically homeless, or who are service resistant, who might have more acute behavioral health challenges to permanent housing? And we'll open this up for the whole panel.
I can jump in. So one of the things that we've done is, again, with that internal supportive services model and wraparound model that we take to addressing homelessness is we've developed our own internal behavioral health team. And so we make sure that we have those services here. And while there's not a specific re-entry therapist or something like that, like there is a re-entry housing specialist or employment specialist, those services are available to this team. And so that has been incredibly helpful. We see our clients really take advantage and participate in this. We are recently having conversations about how to troubleshoot because they're receiving so many referrals from our programs, and that's the kind of problem we want to have to troubleshoot. So it's great to see people engaging in that. But that is one of the ways. The other way is by making sure that we're hiring individuals with lived experience and diversity that reflects the clients and communities that we're serving. Being able to have that connection with people, there's no replacement for that. Not any number of degrees, not any numbers in school or any years of work experience. Being able to have that kind of experience on kind of meeting at eye level with folks is incredibly valuable, and that's something that we prioritize when hiring.
And I'll jump in. The diversion program that I mentioned at the top of my time is actually focused primarily on people who are chronically homeless and have pretty complicated health and mental health needs. And so, seeing that, and I realize this takes resource, but we actually have invested in clinical services as part of our case management teams. And so not only does our county team have a clinical team that's providing oversight that includes psychiatry and nursing and psychiatric social workers, but we actually fund our case management providers to hire psychiatry, to hire clinicians, to fill in those gaps. And so it's really kind of about trying to match the resource with the level of client need. And then also, developing really strong partnerships with our local Department of Mental Health and, our primary care networks, the FQHCs, the local community clinics. And so that we're making sure that we are not only leveraging, but they're really connecting people to really solid services and supports, and that the services that our office funds for those clinical services like psychiatry and counseling and so forth are really intended to be what we call a bridge while we're connecting people to those more robust services, for example, through the Department of Mental Health that have their own funding stream that can carry on forward.
I think the only thing I would add to that, I really agree with all the points that were just made, and is that it really is, as I saw earlier in the chat, the all hands on deck approach. But one of our local leaders in San Francisco once said about this way of working is that the system should jump through the hoops, not the person, right? And so if it's going to be all hands on deck, making sure that those of us who are responsible for the systems are actually doing our work to talk to each other and to make it seamless in as best we can for the individual and meet them where they are, the way Ryan and Jacqueline were just speaking to.
And I would like to add one more thing. So I don't know if other counties offer this. So where I'm from, Santa Clara County, the Reentry Center offers, Santa Clara County offers something that's called a VI SPDAT. I don't know if anybody is familiar with what that is. So when I'm working with individuals, our team is allowed, does have the training to actually do a VI SPDAT. Other organizations also have the training. So a VI SPDAT is a form of housing for chronically homeless individuals that continue to remain homeless. There's certain criteria that you have to fall into to qualify for it. And it's a series of very vulnerable questions. And basically, in a nutshell, it's hard to explain, but what a VI SPDAT is I know we're all familiar with the Section 8 housing, where you enter it, and then there's a very long line, and it could take you quite a while to hear back. Santa Clara County came up with the VI SPDAT that's based on where you fall in the system of being chronically homeless. And so there is no like 1 to 500 that can shift on a daily basis, depending on how the questions are answered due to your vulnerability. So it's a really great tool, and it gives opportunity for the people that are extremely vulnerable to be put into a special queue where housing opportunities open up for them. It's a really fantastic tool that Santa Clara County has.
Thank you, Victoria, and thank you all. We do have a couple more questions. We have another couple of moments here before we go to our facilitated activity. A question for Josie. How can we learn more about the training on speaking housing? And are there any resources on this that you can share?
I can direct you right to Lily Harvey, who helped put some of that together for us, or all of it for some of the recent versions we've done. So talk to Lily. That is my advice.
Wonderful, thank you. And we'll close with one more question for the whole panel. We've touched a little bit on data, and I wonder if folks can talk briefly about how you use data to make a case for housing for this population and how it has supported and can continue to support your funding efforts.
Anybody else want to go first? Ryan, see you unmuted.
Yeah, I was about to respond to a chat, so I'll jump in though. But yeah, I mean, I think, you know, most of our projects, we bring forward a third-party evaluator, and that helps us to, you know, continue to not only get data to, you know, refine our programs and our systems, so that we're, you know, being as hopefully as effective as possible as we move forward. You know, something doesn't work, we don't always know what the answer is, but we can try something new, and data helps us to evaluate that and look at, you know, what makes sense. And then also to use data to tell a story and to advocate for additional resources and additional funding. As I mentioned, you know, a good chunk of the funding that we have, which we're really grateful for, is coming through the Department of Probation and other dollars that are allocated at the, you know, kind of the county CEO level. And so we have to make a case sometimes less to a grant maker and more to our internal county departments as to where the resource is best allocated. And so, you know, each department has their own priorities, and for us to be able to demonstrate, for example, to probation, that the investment that you're making is actually helping reduce recidivism and increasing or improving the outcomes for the probationers that we're working with. And some of the dollars are actually performance based. And so if we can help the probation department increase their performance metrics, then they can actually draw down additional resources to not only continue our program, but expand theirs as well.
Yeah, I really agree with a lot of that. We try to work with third-party researchers as well, but it is also just, to me, this is part of the systems figuring out how to jump through hoops in order to talk to each other. So having those trusted third parties can help us address some of the data sharing issues that come up across health and housing and criminal justice systems, so that you know, that's at least a starting point. And also figuring out how to, if you're going to use data, to also make sure you're including qualitative data and voice of people who've experienced those systems to really humanize any numbers you're sharing. That's something we are receiving feedback on and trying to learn and grow about in San Francisco. And to Lily's point in the chat, I absolutely think that using data in those ways is essential to helping get less enthusiastic partners on board, as Ryan said too.
Thank you so much. And I'll sneak one last question in for Ryan. Does your model include full transparency with property owners when you're leasing property for shelter beds? And the context of the question is recognizing how it can sometimes be difficult to partner with landlords or property owners when we're working with the populations that we serve.
Yeah, absolutely. So we have that conversation on the front end, and we're able to offer some reassurances to the providers, you know, for example, providing double security deposit. Our sites have security on site. And so we really kind of talk through what the program looks like. And, you know, frankly, it comes down to financials for a lot of these folks. Typically, when we're talking about these shelter sites, we're working with developers, but you know, not large scale developers. These are folks that are investing in, you know, smaller single family homes that are renting. And so if they have a duplex on site or sometimes a fourplex, and they can have one tenant with essentially guaranteed rent and the backup of a security deposit and you know, a really steady income stream, then that's financially viable for them. And so we let them know that on the front end. We let them know the you know, as many reassurances as we can provide. And, you know, ultimately we have some people say no. We have a lot of people say no, but, you know, we find the folks that are willing to say yes. And then oftentimes, because again, we're working with developers that, you know, they have multiple properties. And so they tend to actually call us and say, hey, Ryan, are you expanding? Do you have any, you know, I've got this other site available. Are you interested in it?
Wonderful. We're going to go ahead and close out the panel on that positive note. Thank you, Ryan, Jacqueline, and Josie, so much for sharing these resources and your creativity and resilience with us. I'm going to go ahead and hand it over to Nicole for the next stage.
Thanks, Monica. And I'm just going to drop a link in the chat that I will then explain in a couple of seconds. I'm going to go ahead and share my screen. So now that we've heard from our incredible guest speakers, we want to provide some time for active reflection on what we've learned and heard today. So we're going to do this by asking you to think of your entity, agency, or community and identify one thing you're going to start, one thing you're going to continue, and one thing you're going to stop that will help expand housing opportunities for individuals who have been impacted by the criminal legal system. And while we can often feel tied down by the bigger systems in which we operate in, we're hoping this exercise can provide a reframe and focus on where we can actually exercise agency and influence and how we can reallocate time and resources for maximum impact. We do want to acknowledge that we all may respond differently to these prompts depending on whether we're thinking about these questions coming from a personal, a volunteer, agency affiliated, or even another perspective. And we just want to make sure that we're expressing that all of these perspectives are valid. We want to be making space for all of them and really coming from a position of respect and well-intention when discussing. And we're going to be using something called a Jamboard to help facilitate this activity. And on my screen, I've shared what it's going to look like. And so a Jamboard is an online version of a whiteboard, very similar to the kind that we might use to brainstorm ideas together if we were in person holding this convening. And the Jamboard's going to show up on your screen after you click on the link that I posted in the chat. And we're going to send you the link again in our little breakout sessions. And with it, you'll be able to create and move virtual Post-it notes through this little icon. If you click on it, you'll be able to type up some sticky notes. And the Jamboard is going to help us share and observe input and thoughts in real time. Now, since there are quite a few of us here today, we're going to be breaking out into small groups to give us all a chance to get to know and learn from one another. And Monica's going to be sending us out into our little groups, which will all have home-based facilitators. And we're going to be giving you some more information about the activity and demonstrate some of the logistic features and how the Jamboard works, just to make sure that everyone's comfortable using it. But if at any point you are having trouble accessing the Jamboard, it feels overwhelming, you're just, it's just too much, we're going to be providing alternative ways to actively participate. That could be through coming off of mute or typing your responses in chat. And the last thing I'll note is you might see when you click the Jamboard link, there's going to be number of pages at the very top, and that's going to correspond to the small group number that you're going to get. Once again, if this feels like a lot, stick with us. We will walk you through it. And Monica's going to send us off into our little groups now, and we really thank you for your active and open participation during this.
Hello, everyone. Was anyone else mid-sentence? Thank you, group one. So thank you. I hope you enjoyed that. I could have done that all day, honestly, but the Zoom hour grows late. So thank you everyone for participating in that exercise. Just by way of closeout, we know we're coming up on the end. Thank you everyone who stuck around to do that activity. And thank you everyone for joining us today. We want to extend an enormous thank you to our presenters who made a lot of time to help workshop and then be present. To Ms. Quarles, our incredible keynote speaker, for getting us started on the right foot. Right now, Nicole is putting in the chat box our survey. It takes under a minute to complete. You can do it now, but we'd really benefit. And we're hoping to do more convenings like this in the future, and we want to shape them to exactly what you all want to be doing and talking about. And if we get enough feedback back and we think it is enough to sort of aggregate and send around to you, we'll also send you all what people are hungry to talk more about in case you are planning your next convening and we can come. Also a huge thank you to the home base team. There are a whole bunch of volunteer facilitators, and to the core group, Monica, Nicole, and Byla, for putting in tons of work to make this convening come together. We're so appreciative of everyone who took time, a lot of time out of their day to be here and to think through these things. In the chat, just with a few minutes we have left, if people want to share anything that they took away from the breakout activity, we'd love to hear. We don't have, a chance to do the sort of full, robust conversation we'd like to have. But if there was anything that you're really going to take with you in terms of things to start, some things to stop, and some things to continue, some themes you all heard, feel free to plunk it in that chat box. And I'm sure everyone will benefit from hearing about how it went for you. Otherwise, feel free to reach out to us at Home Base if you have questions or follow-up. We will be sending out a robust goodie bag email for you with slides, a recording of this, the attendee list. Again, let us know if you'd prefer not to be included on this list. But otherwise, we really encourage you to follow up and ask questions. If you did ask questions for the Q&A that were not addressed, we'll try to help make sure that you get looped back in and get answers to those questions. And again, happy to talk about the criminal legal initiative at Home Base and how we can help you in your communities if that's of interest. So thank you again to everybody. We'll lurk around till 12:30 in case people have questions or things they want to put in the chat, or you're welcome to come off of mute now if you want to snag a minute of anybody's time with a question.